94.3 The Shark, everything that rocks. It's Orlando. We had a lot of fun talking to licensed clinical social worker Tracey Cardello about dreams last week, and I learned a couple of things. But Tracey is a holistic therapist, and I always wondered about that word. Now, Tracey, I was always under the assumption that holistic meant you ran into the jungle, found a bunch of herbs, brewed tea, and cured a cold. What is holistic, and how does it apply to mental health?
All right, so I'm sure that's probably part of it for some people. But, what I mean when I say holistic is really sort of considering the person in their environment and the whole person. So it's mind, body, and soul, right? So the things that you feel emotionally also show up in your body. Sometimes they show up as aches and pains or a headache or something like that. Sometimes they show up as autoimmune illnesses or chronic disease. So we really want to be watching how the emotional connection affects your body.
You know, I remember, as you say that, always hearing the same thing from my father when I would complain to him about a stomach ache or a headache. It's just your nerves. And I'd be like, man, can I ever get sick around here? But he was probably right a lot of the times. But why is that we get physically sick based on a mental condition?
Oh, gosh. Well, I mean, there are lots of theories about why that happens. One of the theories is because it's a block in your energy system, right? The other is that your body is sending you a signal, and that there is a mind-body connection that you can't deny exists.
We have heard you use the term energy path in the past. What is the correlation between your energy path and your health? Because until I started talking to you, I never thought about that. It's like, well, your energy's bad. Well, I never knew what that meant. I'm learning, but how is that connected to our overall health?
So we have a couple of different energy systems in the body, right? We have the meridians, which flow qi. They are channels of energy in your body that traditional Chinese medicine uses. We also have the chakra system, right, which is more Ayurvedic medicine, or coming out of Indian traditions, right? And then we have an area around the body that's called the biofield, right? And it used to be called the aura, but now we call it the biofield because we sort of recognize that there is a literal energy to it.
And how do you heal that energy? That's what you do, right? With the tapping and all that stuff. Isn't that the basis of what your therapy is?
Yeah, so tapping unblock trapped energy in your meridian. Again, there are like 14 channels of energy that make up the meridian system in the body. We unblock the energy in there by tapping on those things while we're recalling traumatic or uncomfortable memories.
So what is it about, and we spoke about trauma in the past, but how does this affect your energy, and what are some of the ways your holistic methods work to unblock it? Like, how do we even know that something bothers us and blocks our energy?
Well, think about how you feel, right? If you do something and it makes you feel great, that feels like you have a lot of energy, right? And that is not contingent on food or even the amount of sleep that you've had.
As I put my energy drink down.
You can feel really energized, right? If you're in love or if you're playing with your dog, you can feel really good energy. The same way, if you get bad news or think about something negative, you can feel sort of the energy drain from your system. That energy is what we're working on when we tap into some of this energy psychology stuff.
So when it comes to improving on that and your holistic methods, does it vary for the individual, or how long can we expect our energy to be blocked until this stuff starts to kick in? Like, what do we look for to know that it's working?
Yeah, so it's highly individual. I use muscle testing to direct every level of the therapy so that I know exactly what the right goals are based on your muscle testing. I know what patterns are interfering on your goals. I know by how much because we measure it. And then I know what intervention to use with you and if the intervention is working, all by using your own muscle testing, or we call applied kinesiology, right? And that helps us to sort of drive the therapy in an incredibly personal way and find out if your blocks, have to do with trauma or something that affected you in this lifetime and, or even past lives and your ancestors.
So it seems to me that holistic mental therapy has a lot more to do with facing your issues and using some of these tapping techniques and muscle testing and things like that, but facing some of your issues as opposed to medication, right? Is that what makes it holistic, not using medicine?
Well, certainly medicine is helpful for some people, and that's something that you have to talk to your doctor about.
Right.
But, this is something that you can do. This is therapy, right? So this is something that you would do in addition to medication if you decide to go with that option, and that you get a lot of benefit from it, whether or not you choose the medication route.
Right. By no means is anybody saying take medicine, don't take medicine. I was just always under the assumption that holistic anything is either an alternative medicine or working without it.
It's certainly both. I can't advise anybody on how to pursue that. That's something you have to speak to your doctor or psychiatrist about. But yeah, when people decide to go the route of alternative and not medication or not Western medication, these are definitely types of therapy. I consider it alternatives to like standard mental health therapy and traditional talk therapy or behavioral therapy, right? Because we're really sort of finding things very specifically and working on them in a very methodical way.
Well, looking at your YouTube channel and your Instagram, which is Tracey Cardello, I do see you having this somewhat demonstrative approach, the tapping and all of that stuff. Well, like I've gone to therapists before, and I just felt like sometimes talking for an hour worked and sometimes it didn't. And sometimes that was dependent on me and sometimes it was dependent on a therapist just not getting the right stuff out. But it almost seemed like more work trying to figure out what to talk about.
Yeah, it can be. And the thing about talk therapy is that you only know what you know. And if what you know are grievances and problems, then that's really what you're going to talk about. And obviously, the more you talk about those things and focus on them, while it can be helpful to share that information with with someone other than just keeping it inside, it doesn't necessarily help you to get past it. So what I found when I sort of made the switch myself from traditional talk therapy to more energy-centered holistic work, right, is that there's a lot of stuff that I don't know. In fact, practically everything. And so I can find that information using muscle testing, and I can clear it using interventions that are pretty easy and painless and fast and permanent in most cases.